Okay, let's go ahead and get started. Welcome everyone to another Insights from Women Leaders event. My name is Rola Kaakeh and I'm the CEO of Salus Vitae Group, and I'll be the host for the event. For those joining us again from the 2020 series and even from our first 2021 series last week, welcome back. And for those that are new to the series, welcome. We're very happy that you have decided to join us today and join this conversation. Now, a little background on the Insights from Women Leaders series. We launched this series in October of 2020 as a platform to hear from women leaders with varied backgrounds and perspectives on the topics of leadership, addressing current and future challenges, what skills we need moving forward, and how their experiences have shaped their outlook. The goal is to learn from women thought leaders and decision makers to empower current and future leaders, both men and women, to positively impact their communities and organizations. Diversity of thought, experiences, industries, education, and training is important to us as it highlights the mosaic of perspectives that are represented in different settings that help drive decision-making and positive change. Now, our guests have been from various prestigious and reputable institutions across the globe. Their backgrounds are diverse, their accomplishments many, and the insights and perspectives that they've provided have been extremely valuable. Again, this series will highlight the journeys and contributions of these various women leaders as they share their insights on a range of topics impacting our communities and their role in shaping the future. I encourage everyone to check out the recordings of our previous leaders if you haven't already done so. We have over 11 so far, and we have several others in the coming weeks. They're all available on our website. Now for today, over a course of an hour, we ask our guest leader a number of questions. I will start first, and then we'll actually open it up to audience questions. So please, if you have any questions, submit them in the Q&A box, which you'll see in kind of your dashboard. There is a chat too that will go directly to the panelists, but we encourage you to use the Q&A box. We also encourage you both during and after the event to post any takeaways that you have from the event, both in our Q&A box if you'd like, or on various social media platforms. And you're welcome to tag us at Salus Vitae Group. We always love to hear how you benefited from the various insights and experiences that were shared by our distinguished leaders. Now, the session is recorded and will be available for replay after the event. Now, let's go ahead and get started. I'm very pleased to introduce and welcome our guest leader today, Dr. Rola Hammoud. Dr. Rola Hammoud brings over 25 years of experience in anesthesiology and 14 years of experience in healthcare management and consultancy on governance, strategy, and quality service delivery at a global level. She founded the Lebanese Society for Quality and Safety in Healthcare in 2012 and was elected twice as its president. In addition, she's an academic lecturer on patient safety and risk management and a reviewer for anesthesia and quality journals. She is a national and regional speaker on healthcare quality and accreditation. She's an expert on the National Committee for Lebanese Accreditation Standards Development and a training faculty for the Surveyors of the Lebanese Ministry of Public Health. She graduated as a medical doctor from ULB in Brussels and as an anesthesiologist from the American University of Beirut. Dr. Hammoud is American board certified in healthcare management from the American College of Healthcare Executives and is certified from the Harvard Business School in the management of healthcare delivery for executives. She holds a master's in hospital management from ESA Business School and University of Paris, a teaching diploma and a meditation diploma. Welcome, and thank you so much for taking the time to be with us today.
Thank you, Rola, for this introduction. I'm very happy and very proud to be with you today and with all women leader and men leader, especially in healthcare, if we have some in the audience.
Welcome. Okay, so what we tend to do is we jump right into the questions. We also are asking a lot of our, all of our guest leaders very similar questions just to kind of gauge the different thought processes because each of them have very unique experiences and perspectives that they can provide on these issues. So what we tend to do is we ask the same first question and then we go through from the future to the present, and then we'll focus a lot on leadership. So our first question is, did you expect to be where you are today?
Well, the answer is no, not at all, actually. I've never designed a career for myself in healthcare management. I wanted to be a doctor, and I used to be an achiever at school and at medical school. So I wanted really to be a successful anesthesiologist because I had a passion to see the immediate effect of medications on patients and the response to the treatment on patients and helping them to recover and to have painless healing processes after surgery. And I also wanted to grow in the academics part. So doing research, understanding many unanswered questions in medicine. So my purpose at the time where I was doing my studies was to teach new generation what we know and what they need to look for in the future. Unfortunately, well, fortunately for me today, this did not go through this. I did not go through this path of academics because I was moving a lot around Europe and the Middle East during my studies. So I was more exposed to working in academics, but more after graduation in private practices. However, this was a great exposure for me, and I learned a lot from being exposed to those private places where I was at, whether it was working in Europe, in Belgium, in Switzerland, in the UK, or in Lebanon, in rural hospitals, or in the last hospital where I work at was Clemenceau Medical Center in Beirut, for which really I owe a lot in learning and growing and achieving to where I am now. I was able through this diversity and through this path to learn more about being flexible, about diversities, about cultural integration. And this enriched really my knowledge and my skills in medicine, in anesthesiology, and of course, what is important today is in healthcare management. And this is all this exposure helped me to grow in the management field. Having all the experience, the clinical experience in anesthesiology and in medicine, help us to know more about the processes, the pathways of patients during their journey from the admission up till the discharge. And this is how I got passionate about learning more about this journey and all the interactions that are affecting this journey from admission until patient discharge from the healthcare system or the hospital.
So when you look at this in terms of how that's shaped to, like your past experiences, how they've shaped where you are today, and your willingness and open to kind of learn in whatever environment that you are in, even if it wasn't necessarily your initial goal of kind of from the academic to then the private sector to being in all of these different settings, and kind of how that grown has adapted. But when you look towards your future, right, when you start thinking about where you want to make an impact, what does your future look like? What do you want your legacy to be?
Yeah, so I was driven all through my career by doing well and helping people to become healthy and well. So my legacy would be health and wellness to all, without differentiating, without treating more people than others. I want to participate really in building the best models of healthcare. And when we say best models, by the definition of the Institute of Medicine, those are the safe, effective, patient-centered, equitable, efficient, and timely systems, where the patient can find all what he needs in one place in a safe way and effectively and timely. I want to do this while maintaining really my beliefs and my ethics and my values. And when I say this, it's because it is very important when you have a purpose just to reach to this purpose and to reach to your objectives while maintaining really your values. And our values in treating patients are very important for us to maintain. I want to tell women of my generation and of the future generation that yes, it is possible to be both a leader in your work and at home. Yes, it is possible to grow our vision beyond our circles, you know, the small circles. It's possible to go outside of our comfort zone and reach out to our communities and more to the world. Perseverance is the key word. I tried, I failed many times, and I tried again to grow and establish what I wanted in order to reach my goals. Taking challenges is one of my concepts in order to grow and reach the objective of having healthy and well community around me.
I want to note something that I absolutely love in your kind of explanation and how you're talking about legacy and the future in terms of your values. And I think that's so strong of what also reiterates our own legacy, our own future, is that when you maintain those values, and I think I kept hearing that regardless of your experiences that you had, and you talked about being successful and failing in certain things, but you had that consistent value structure, which you then named. You talked about what's important to you, which kept you going, which I think is so nice to tie into a legacy, right? Because it's not just what you want other people to know about you. Do you want to stay true to yourself? Are you proud of what that is? And instilling that is really, really nice. I really like how you tied in and emphasized value within that, your value stream. Okay, so the next question, so you talked a little bit about your past and present experiences and thinking how that's shaped you, and the way that you've also summarized it in that there's ups and downs, but there's still a bigger path and a future for all those that seek it kind of outside of those circles. And then when you also think about the future, what excites you? What are you really looking forward to when you're trying to shape this future?
Yeah, if I want to look in my past and my present experience, in each step of my career, I was doing something in a different way. So as anesthesiologist, when I first started after graduating, it was all about teaming up with surgeons, educating patients, following up on my outcomes with patients, developing my protocols in anesthesiology, building my skills to administer the safest care in anesthesiology and in the post-op period where patients tend to be still fragile. So I promised myself during the beginning of my career really to dedicate the work I do from before starting the surgery up till far after ending the surgery, which is following up patients after their procedures. And then I moved to become as a chief of anesthesia and director of the operating rooms, where here the challenge was bigger. So I'm not working only at the level of my patients, it's working at the level of the whole hospital's patients in the operating room. Where it was very meaningful for me to work on building teams, having consensus on standardizing our protocols, to set targets for patient outcomes, to stream up processes and establish guidelines for best practices in the operating rooms and for anesthesia specifically. And of course, when we manage the operating room, we set like key performance indicators to measure our productivity and to measure the utilization while maintaining safety. And all this I was doing out of experience, out of curiosity, out of the willingness to learn more. Nothing really I haven't done any studies in order to be able to do this and become expert at it. At a later stage, I moved my career as a Chief Quality Officer at Clemenceau Medical Center in Beirut, well, as a medical director, a medical quality director first and Chief Quality Officer afterwards. And here I participated in the design and the implementation of a robust quality system with the support of really a very strong and empowering leadership. Really my eagerness to continuously improve my skills had led me to go into further studies. And as you know, Clemenceau Medical Center is affiliated to Johns Hopkins International, and I must admit that I learned a lot during my stay in this career. I learned how to implement the safest standards of practice and what are the Joint Commission International standards. And this is where I helped also Clemenceau in going through many accreditation, JCI accreditation processes. So I wanted to continuously improve my skills, and this pushed me to acquire more certification in healthcare management and perform the 360-degree evaluation of myself by asking my colleagues and peers and subordinates to evaluate me. And this is where I got I set an action plan, actually. I received all feedback positively without getting defensive. I revised my plan and I added the new input from my colleagues. I included in my plan how I am going to measure my progress. And actually this plan had been followed with me by the American College of Healthcare Executives, where at that time I was also pursuing my degree with them. And I was able to learn about, emotional intelligence and how you can adapt those criteria into your practice. And at the later stage of being the founder and the president of the Lebanese Society for Quality and Safety in Healthcare, I decided at that stage that I need to give this expertise to all people of Lebanon and not only to a specific community in Beirut. I thought that it's about time that everyone gets the best care. And this is how we built this society. We are a team of people. We are 7 persons who care about the quality of healthcare. We built an NGO. We are all volunteers. We do this for free and in order to help raising the standards of care in the Lebanon. So we organized yearly congresses beginning we started in 2012. So we had conferences, scientific meetings. We got speakers from international speakers coming to Lebanon to talk with, to share their experiences with healthcare providers in Lebanon. We collaborated with the Lebanese universities to create workshops, to teach about risk management, about quality standards. And we also collaborated with the World Health Organization, where we had an initiative done, we called it the National Patient Safety Goals. Among hospitals, we did trainings and workshops for healthcare providers in hospitals about those goals, the importance of those goals, how to measure those goals, how to establish those goals in their institutions. And also we asked, we did an awareness campaign to patients themselves. So we have chosen public places to go and visit and explain to patients about their safety in healthcare systems and how can they be alerted about this and how can they participate and be engaged in ensuring their safety. And this was done as a campaign also with the help of the Lebanese Ministry of Public Health and the Ministry of Interior in Lebanon. I also participated with the Lebanese Ministry of Public Health to train surveyors on accreditation systems. And recently I moved with Clemenceau Medical Center to Dubai to lead the medical team and to as a chief medical executive, where I am building the team of this institution to represent CMC's mission and achieve its vision out of the borders of Lebanon. During a pandemic, it was not easy. The first year was last year, and we're continuing this year. The pandemic has hit hard all over the world, but I can say that this has given us a lot of experience and a lot of knowledge. We tested our system, we tested the way we do the risk management in our institution, and we are really proud to say that today we achieved to manage whatever patient we had, COVID patient we had, by following the safety standards and the international protocols that are being updated every day. So my new role is to make really a difference and to add a value to patients in Dubai by following up those treatment protocols within the high-tech environment and the state-of-the-art facility that we have built here in Dubai.
Very nice. So you're definitely, from the conversation thus far, someone that does not sway away from challenges and definitely takes them. And so many of our audience and with a lot of our guest leaders, we talk a lot about tools and specific thought processes that you went through. And as you were talking, the themes that kept coming to mind was very much, you know, especially the one towards the end in terms of generosity, as you kind of went to grow and think about what you know and what you can provide to other people in terms of tools that you need, your curiosity, your willingness to learn within these various challenges. And it seems like you often very much reflect at what you do know and what you don't know, which I think there's so much value in that as we think about our challenges and what we're doing and kind of how you've positioned your career as well. So curiosity, willingness to learn, dedication, your value system, it's something that seems to come up constantly for you. Are there any specific tools that you think are very important, other than the ones you've already mentioned, for those that are thinking about these big worldly problems and their role in trying to address them?
Yeah. So yeah, as you said, Rola, I would put continuous learning mode is the first really tool that I used and that I advise others to use. It's not wrong to be curious. It's not wrong to ask questions. It's good to ask really powerful questions in order to get answers and learn more. The other tool that is very interesting is being creative. And this is something that I learned really just recently. I didn't used to, perhaps it's the nature of the growth of your path, but of your career path. I mean, creativity is important. Creativity is very helpful in cases of uncertainties. Whenever we feel that there might be surprises, so we have to asking always the question, what if, is very important, and finding the scenarios and solutions for this what if in order to mitigate risks and have safer environments. Innovation also is very important, and I think there are people in the organization who are have this the added value of being innovators. But what I find in myself is that I am open to innovation. I'm open to continuous improvement. I'm open to change. So this is important tool to accept change and be very empower people to execute the change. We have to believe that we are living in a very, very quickly changing environment. So if we don't do this ourselves, we will not meet this environment and we will be delayed. So we have to keep it up the pace by also innovating and continuously changing. A tool that I find very important is to set a common purpose for everyone in order to proceed in our mission and to reach the goal that we have designed for ourselves. Being transparent is very important, especially when we are in a crisis situation. You don't want to hide anything from your team. You have to be transparent and expose your problems because you need support, and this is where the conversation starts and where you exchange ideas in order to bring more solutions. Building teams is a tool that is very important, and the teams need to be teams do not need to be really homogeneous, so it has to be heterogeneous teams where we can encourage discussions and exchanging information in order to and even conflicts in order to reach a meaningful purpose. Trust is also a tool that we need to establish between all members of teams, and of course staying positive and helping people to reach their goals is something also that we need to achieve in order to build resilience and take care of ourselves.
I love also how you integrate the creativity with innovation, especially as a leader in the patient safety space, because I often feel like in healthcare, we're always apprehensive about too much change or being too creative or trying to think just because of the concern of patient safety, and even from a pharmacy standpoint, medication safety type of thing. But when you have a leader like yourself in that place where it's like, no, it is necessary, and you know, you have that creativity in you, which a lot of healthcare providers aren't often told they're creative because we associate that with other professions. And I think that's so instrumental, tied in with so many other elements that you discussed in terms of still having that common goal and common value system for that. So now let's just talk a little bit more about the present. Like you mentioned, and like all of us know, we are in currently a pandemic, and what seems to often we hear a lot about the different challenges that the pandemic has brought to light, but also there were challenges before the pandemic. It could be the pandemic, but are there specific obstacles or challenges that keep you up at night?
Oh yeah, Rola. So you know, being a responsible person, we are responsible of patient lives, and when you treat COVID is a disease that is not very well known. You don't have protocols for it. So we have to update ourselves every day with the recent protocols. So patient safety is basically what keeps our minds working all the time. Patient care is my team's responsibility, and I'm continuously thinking about what can I do more to ensure that no harm will affect any patient during their care in the hospital? About how am I going to ensure a convenient platform for clinicians to work in a safe environment without hurting themselves as well? And also I think about minimizing losses and maximizing positive outcomes. So those are continuously on my mind, whether day or night. And of course, talking about patient safety, you know, the COVID had hit very hard, and you know that most of the patients that are admitted to hospitals are really very sick and needs ventilators and mechanical ventilation and stay in ICU. So here comes a lot of concerns about those patients, and the other thing is health, the occupational health, which is also important. And our latest challenge was vaccinating all hospital staff against COVID, which we achieved only last week. So those are the things that are on our minds for the time being. And I'm sure there will be more and more in the days to come with new challenges and new diseases. So this is not the end.
Yeah, for sure. So is there a specific initiative that has resulted from the pandemic that you'd like to share with us, that you're kind of excited about? Because with struggle sometimes comes opportunity, and we've seen different types of initiatives come up as a result. So is there anything exciting that you're working on that you'd like to share?
So the first initiative that was very nice to talk about was how we managed as a team to create a group to tackle this pandemic. This group worked on establishing the workflow and the work processes before even admitting patients. So we had a plan in place, we had everything set, we had the negative pressure area prepared, we had the staff ready. So the team was very efficient in this, and the infection control team, officer, doctor, nurses, they were great at at executing this plan. We set up the telehealth consultation process early, in the early phases in last March, where we encouraged people to stay at home and encourage them not to go out, especially during the lockdown. This was done really with the platform that we had in the hospital. We did a lot of home health visits to advise patients at home about any diseases, blood sampling, vaccination of children. So all those were done. Those are ideas like I was talking about. Those are the innovative ideas that started during the pandemic. And recently, we are having a post-COVID checkup clinic for patients who recovered from COVID, who wants to check on their lungs, on their hearts, on their kidneys. So they come, they visit physicians, and they perform specific tests, their antibodies, and all what is related to the disease. The most important part also is that all our physicians are there for the community. We are doing awareness sessions for the public about the disease, about the sequelae of the disease, and how to protect yourself or how to treat yourself afterwards if you contracted the disease.
Very nice. Okay, so now we're going to transition into the topic of leadership and mentorship in general. So we ask all of our guest leaders a simple question. It's not a simple question. All these guest leaders keep telling me it's not as simple as it sounds, because I have our guest leaders answer it in a max of 2 sentences. And that question is, how would you describe a leader? You responded with the following: a visionary person who adds value by leading people from within and showing them the way. They have the willingness to respect. They serve their people and listen to them. They have wisdom, integrity, ethics, and respect to people, and respect to people are their values. They make a difference wherever they go. Can you elaborate on this and really what has shaped your outlook for this specific kind of definition?
Yeah. So my analogy to a leader is a person who is holding the light for the people who are walking with him. And to guide them through a path where he knows where it is ending, and just to guide them through this path to reach together the destination. She doesn't need to be at the front. She can be near the persons, near the people, talk to them, walk with them, and walk them through the different challenges that are on this path. What I meant by leading from within is talking to people and getting the best of them, out of them. Like all this is how having the opportunity to just let people work their way and just discover the way they can work better and get the best out of this, stimulate them to go up the ladder and give them the credit for the work, encouraging them and make them feel like heroes is very important for them to reach where they want to go. Listening is a skill that we need to have, and coaching is another skill that is very important. Myself, I was coached myself by many people, and myself I coached many people in order to reach what they want. And of course, doing the right thing at all times and not being biased and being fair is very important. Those are the values that we need to keep in mind in order to teach and lead by example our team, to create sense and purpose for them, so they would be motivated to make the change happen. And of course, there are many leadership styles. We don't want to go over all styles, going from the authoritative to the democratic, the coaching, the affiliative. But what I personally use is the situational leadership style, which is adapting my style according to the situation. And as you know, Rola, in healthcare, situations changes very quickly, and a patient can be very stable and suddenly he can flip into unstable or critical problem. And this is where I learned to change my style according to the situation. And of course, leading in a crisis situation is really different from leading in a very formal meeting where you have time to discuss. So it really varies according to the situation. I believe that there is no uniform leadership style that works for everyone at all times, and this is where everyone has to find his style, that's the style that matches him and his people.
I like that you bring up the situational type of leadership, because it's something that many leaders talk about, humble leadership and kind of their approach to teams. And I absolutely love too the light analogy, for the fact that even if the leader is first the initial light, but if you bring out the best in others, bring out the best in your teams, have their light shine, it is much brighter as well. So it's a very nice analogy with regards to kind of the presence of your impact and the role that the team plays. And something that I also noticed a lot in our conversation, you're very much a transition of care, and being very intentional in each situation, what is best for that situation. So when you brought that up, I smiled in terms of situational leadership, because it's still very much like whether you take care of the patient from the moment they walk into the door to when they return and they're at home, from a healthcare standpoint. And then even within your career, as you kept talking about, when you transition from one position or challenge to another, you were very intentional about it. And I think when you layer on top of that the leadership style of that, it makes things more actionable. It allows people to think that when I'm in a situation, then my leadership takes a certain role, correct?
Correct.
And I feel like your heartbeat throughout all of it is the ethics and the values that you've put in. That seems to be consistent, which I keep mentioning, but I think it's so powerful within leadership as well. You talked about there being different types of leaderships. Is there anything that you feel like when people talk about leadership that we're getting wrong about the topic from your experience?
Leadership is it has the same concepts in all industries really, but what makes it different What makes it different in healthcare setup is the concept of complex adaptive systems. So as you know, Rola, healthcare is very complex. It has many stakeholders, physicians, the nurses, the pharmacists, the paramedicals, administrators, dietitians, engineers we have in healthcare setup. So this complexity makes it very hard to manage and harder really to lead. If we put in our minds that it has to be person-centered, so patient and staff, we have to spend time at the front line. We have to think of ourselves as coach, to focus on the vision and the strategy, and to be transparent and think about the system and not about really a person. So what we can get wrong about leadership is that, oh yeah, we know it all. And actually, no, we don't. And this is why we're in a continuous learning mode, where every day we learn something new. The other thing that we get wrong is that we can make all decisions. So yes, there are times where we feel that we know and we can make the decision, but it's always good to talk about it and to have a group decision making for specific items or for specific concepts or issues. The thinking that quality improvement does not count is another thing that leaders are wrong about, because there is no quantity without quality. And for me, this is very important. I mean, if we are going to think only business, only measures, only indicators, we have really to think about the quality of the care that we give to our patients. And another thing that we can get wrong is that the problems are one-dimensional. In healthcare, they are not. They are really very, very multifunctional and multidirectional. They affect many people. And I always have this analogy that we are all in one boat. And if there is a hole in this boat, the whole boat will sink. And it's not only one department or one area. So those really are the things that we need to improve and take into consideration in our leadership.
Yeah, I like the notion to constantly evaluate not just what you don't know, but what you can improve upon in this kind of this overarching. And I mean, we talk to a lot of experts in general. We know a lot of experts, and true experts will tell you what they know, but they'll focus so much on what is yet to be learned, what we need to grow and develop. So I think there's a lot of power in that as a leader. So I do want to make sure I get this one question in, because we also do have a lot of questions from the audience. So before we go to audience questions, and kind of then we can come back to the lessons learned towards the end as well in terms of advice. But for this last question before audience question is that we generally take an opportunity to support one another and recognize the positive influence we have on one another. Can you name a woman who's inspired you, and why did you choose this person?
It depends on the stage of my life. So during my childhood, so my mother taught me a lot, and she was she had a really very powerful impact on me as a leader. I am the eldest, and I used to be held responsible for many things at home. So my father used to be out frequently traveling. So she trusted me, and she built in me this person on whom she can count to help her at home. In my adulthood, I had a teacher who, and one of my colleagues actually, who used to be my idol, because I used to see in her me in the future, about her values, her ethics, her behaviors, her involving others, and creating this safe environment for discussions. And in the current situation, I was really influenced by the New Zealand Prime Minister, Jacinda Ardern, for the way she led her country to overcome the pandemic and reach really the near zero infection rate with her baby on her hands. So this was very impressive, and I keep this image in my head. So yeah, this is those are people that keep the traces in your style.
Very nice. Okay, so we're just gonna go to some audience questions. So one question that we had is, what advice can you give to working women in the healthcare sector who are facing the challenges in Lebanon to prevent becoming demotivated and burnt out?
Yeah, it's very difficult during those times especially in Lebanon. Lebanon is undergoing a lot of pressure and a lot of stress. Very difficult for people working in healthcare. My advice is to stay positive, to think about the good things that you are doing. You women leader in healthcare in Lebanon are saving lives, and this is something you should be proud of. Now, it's very emotional, and really those, to prevent being burned out, we have to do many actions like doing mediation, mindfulness, take care of something you love, just get disconnected from your environment. You can stay in a place where you can listen to something you like or look at something you like, and this will help you keeping up the pace. And we have been there. I've lived the war in 2006 in Lebanon, and I know how hard it is. But just the purpose of saving lives should be enough positive for us to keep on going.
Thank you for that. Did you at any time have a career crisis where you questioned everything you're doing? If yes, how did you deal with it?
I had this at several times in my life, and many times. Without those, we cannot grow and we cannot reach where we are now. How to deal with it? Each one had a different way of dealing. My advice for those crises is that you think objectively. You just forget about, especially we women, we tend a lot to have emotions. So just forget about emotions and just put facts, and you can write those and balance those positive things, negative things, and just try to find a solution. Another thing that might help is talk about it to a friend or someone you trust. Just to give you advice, and when you talk about it, you will feel where are the opportunities and how you can solve your problem or your crisis.
I like that answer, because I find when you hear that, especially people that are very successful in their career, people think that they've always had it figured out all of the time. And when you're natural instinct is to question things to make it better, you're going to naturally do that for yourself as well, right? Like, how do you constantly improve? What do you still need to learn? What do you still need to do? And so those types of crises, to me, are always just a reflection of that. Means I feel like there's a gap in something that I don't know, or that I'm not doing, or that's not fulfilling enough. And so it's generally then becomes exciting to figure out what that gap is and how you can fill it and what sorts of things. And from the conversation now, so much of it is driven whether you're curious curious or creative, or where you adapt. Sometimes it's the teams that you create that kind of help lift that up for you. We do have a question about what do you do when you're the only woman in the room or the only woman leader?
I really don't feel a difference. I never felt that because I'm a woman, I'm different from others. Perhaps few times in my career, I noticed it, or someone mentioned it to me. But for me, from my within, I don't feel that I'm any different. I think women are privileged because they think by their head and their heart. So this is something, an added element to us. And I mean, sometimes you feel that, you cannot talk as much as others. It's not because you're a woman, perhaps because it's you'd like to listen more. I really never felt that it's different.
I find too, when we've talked to different guest leaders, kind of the concept of what kind of mentality you bring in as you come into the room as well, in terms of it being a barrier or something that helps you. So if you think of it often that, oh, I'm the only woman in the room, and that's something that you associate with having a burden, it can paralyze you, right? And so restrict it, versus kind of having that openness, which I see a lot in the conversation of when you do have that openness to learn, that openness to contribute, that generosity for others, you don't really think too much about maybe the barriers or items that might be reflected on your end, because you have that generous mentality, that ability to kind of give. So I think that's very interesting there. There's also a question about how your mindset has changed. That we talk a lot about a growth mindset versus, maybe other mindsets that you might have throughout your career. Have those changed for you throughout the years, or what does that look like as you've progressed, be it your positions or the issues that you're working on?
Yeah, sure. The mindset would change a lot during career. It changes already during our age. I mean, with age, the mindset would change. And it's not the same when you're starting a career, when you're enthusiastic about the work, when you're afraid of doing mistakes, when you want to please to your boss or to your superior or to your teacher at the university. So, and then, I mean, with the career growing, another mindset comes, and don't forget, there's the mindset of the mom with the children at home, and the wife. All those changes with age already. And with the career, to top it up, of course, because each position has its own challenges, and really our mindset will change automatically with the challenges that we are facing, and with the actions that we are taking. And I think this is very good and very beneficial, and it helps us to grow and to reach our targets.
You could even have a situational mindset right now.
Yeah, exactly.
And it's nice too, because and talking about it like that in terms of even layering your mindsets, right? Sometimes having multiple mindsets there and using them in different situations, sometimes using different approaches, and not having to feel like you have to always just do one particular thing. You can have kind of that mosaic, like we mentioned before, of different things. I want to make sure that we do get this one question in too, about, because of a lot of our audience can vary from all the way from students all the way to top executives. Is there any specific advice or leadership lessons that you would like to share with our very diverse audience at different stages of their career?
Yes. I just want, I mean, there will be many advices, but I want to tell them just to be the leaders who can lead with empathy, And recently with healthcare, we're noticing that there is less and less empathy. So in order to improve patient outcomes and to have happier workplace, empathy is very important. Be the leaders who can cope with all pressure from various demands. Of course, we all have margins, budgets, scorecards that we need to meet, but at the same time, we have to cope with all this pressure in a way to provide a care for a patient. We're dealing with human beings, we're not dealing with machines. So, always involve others, reach out beyond your environment, beyond your department, beyond your institution, connect with people outside, connect with expertise, international people, have broader set of more sources to rely on in order to help you learn faster and to become great leaders.
I love it. I love the approach to not only seek more. From listening to you, I always feel like, yes, seek more, but because there is more, right? There are those different people, those different groups that you can go and learn from and grow. And I think naturally, I mean, learning is something that I absolutely love, and it's such a necessary skill to do, to be able to know and what you don't know and learn and adapt. But I think creating those environments, like you mentioned, that are a lot more optimistic, that want to change, have that ethics and value system that is consistent and will really grow. I really, really like those. And so is there any other final thoughts? We're only a few minutes from closing that you would like to add that we have not discussed yet?
Perhaps to be optimistic and really this is very important also. So be optimistic and serve people. And this was my motto years ago. I started by being a servant leader, where I used to serve not only patients, but also colleagues and friends. And I think this can bring a lot to a great leader.
Yeah. Definitely. We talked a lot about, the challenges, the very big challenges, the crises that we face right now, no matter where you are in the world, are very burdensome on many, and having specific types of these positive mindsets, this willingness to provide your time and expertise to help those, and know, like you had mentioned earlier, for those that are in the healthcare space, that you are heroes, you are doing a lot, because you do have that common goal of helping those wherever you are. So that is a wonderful way to conclude that conversation. On behalf of Salus Vitae Group and myself, I would like to thank you for joining us today and for sharing your experiences and outlook. It's been very positive. It's been very, I feel like, empowering in terms of learning to recognize what we can do personally, but how we can all grow collectively through recognizing what still needs to be done and our place in doing it. So there have been several actionable items that Dr. Hammoud has shared with us today. And so I encourage you, if you want to listen to this again, the recording will be available after the event. We have several other exceptional leaders in the coming weeks. So visit our website, salusvitaegroup.com, to register for them. They're very diverse, and they will continue to join in this conversation about women leaders, women decision makers, thinking through how we can spread, as Dr. Rola had mentioned, spread beyond our circles to make the most impact within our communities. So thank you again for joining us. Feel free to tag us at Salus Vitae Group and share with us your takeaways from this event. And we hope to see you at the next event. Thank you so much.
Thank you, Rola. Thank you.